The evacuation drill is our disaster preparedness event that we have for our seniors. It's our culminating event for the undergraduate nursing curriculum. The simulation curriculum that we design, our goal is to help students feel more confident in their skills and to enable them to critically think through a variety of activities or situations that they may come up against. And another important part of it is actually to help them manage some of that anxiety and stress that comes along with being put in a novice situation. Because you're going to be out on the floor and a tornado comes and it's going to be the first for everybody there, whether you've had 30 years of experience or 5 minutes and it's your first day. So what can we help you do to manage and move forward in a positive direction?
Simulating the role of the nurse, I was definitely nervous. I was scared, didn't know what to expect or how the simulation was going to go. My group and I, we were the final group of nurses that went in. So we were group 3, there was 2 groups that had gone prior. So we were sitting in a briefing room watching all of our peers go and saying, okay, we're gonna do this differently, we're gonna do this differently. And we went in there and it did not go as planned. So that is something that you're not gonna have any way of knowing until you're the one standing in the room doing the simulation. So I definitely think it brings a really unique experience to the nursing program and one that you can't get from being in a classroom.
So for me, I actually played the role as a patient throughout the simulation. So I got to be one of the people relying on my peers to take care of me and make sure I got out. So that was kind of cool to see because I got to kind of sit back and watch the teamwork unfold and them kind of reason and use their judgment to figure out the best way to go about things. It's like, oh, who got me out safely, who didn't, what could they have done better, and then I got to provide feedback on what they could have done to improve on their skills.
So this is a really good experience to, have that foundation to fall back on and revisit those foundational skills of prioritization and delegation of tasks and communicating with your colleagues and your patients. So it was definitely a really cool experience.